Welcome, everybody, to the Everyday Health Hacker Podcast. I'm Mike Herzing. The show is coming to you from Meridian Health Institute right here in Sugar Land, Texas. Great place in the world, isn't it?
Yes,
awesome?
It's a beautiful day.
Everyday Health Hacker is a brainchild of Meridian's Chief Medical Officer, this wonderful lady right here, and my great friend, Dr. Lisa Leal.
Hello, everybody. Welcome back. Can't wait to talk about our subject today.
Yeah.
How COVID has changed telemedicine forever.
Well, I don't know. I think it was starting to change before, but let's talk about that. We talked last week about the staff and everybody's cool, and this week we want to talk about recent changes in the way doctors do business because of COVID, like you said. But then again, let me preface it because I remember back in 2016 or 2017, the insurance company I was using started pushing telemedicine service. It seemed pretty cutting edge back then. It was pretty exciting. But now it's a way of business. You do it. And of course, you take longer than anybody else. I mean, everybody else's telemedicine thing is a few minutes. Yours is
let's be
longer.
honest. We've been doing video conferencing for 25 years.
Yeah.
And teleconferencing for 25 years. It's new that insurance is now covering it, which allows people to continue their day and not take a half day off to go to the doctor, go to the pharmacy, and then go back to work. So it's time saving and it's more productive for individuals. The key, though, is that how do you build a relationship over the phone? And that is something that I encourage all the listeners that when you're talking to these doctors, nurse practitioners, whomever the healthcare professional is that you really concentrate on building a relationship with them and that you demand that because you want them to know your name and I want you to know them as well, that you can call in the middle of the night and know that they're going to help you with whatever dilemma is going on with you or your family members.
But why do you know you're going to get the same one next time you call? If I'm calling so-and-so doc.
And that is probably one of the most difficulties with some of these big telecommunication companies that, we can name several. And I will share at Meridian, you're always going to get the same 3 people, and you're always going to get the same doctor within that. And the key is...
Even though she might not be getting any sleep because you're doing this.
Well, I signed up for this. I tell everybody, I signed up for this. When I went to medical school, I knew what my life would be, and I'm excited to be able to serve. And, we have passion for our service for others. For me, it's like, oh my gosh, somebody called me and they need my help. I'm excited about that.
Well, you get that feeling of accomplishment when I've actually... It's like me fixing something. Yeah. Oh man, I fixed this myself and I just feel so good about it. And it feeds me. And that's how you are.
It's an I'm okay, you're okay. It's one of those things that this is what my vocation in life was chosen to be. It was chosen for me by God. And when somebody calls, I know that they're calling because they need answers.
Right.
So if they call, they're not calling to disturb the doctor. They're calling because they need help. And I've had many a patient that they're in the hospital with a circumstance and they're calling because the doctor's there are not giving them the answers or the communication that they need. And that's when we rally around and we do a telemedicine with all the doctors involved, video conferencing, and we all get on the same page. And it's just about communication. And telemedicine is very important in the sense of I don't want anyone to go through a lot of these telemedicine. At the beginning, I had shared last week that I had volunteered. And in that volunteer, one of the reasons why we started changing the way we volunteered was because they had a protocol of what you had to do first. You had to do step 1, step 2, step 3. And if you did not do that, they would send you an email that wasn't very pleasant and because they wanted you to doctor their way. Well, I'm an independent thinker.
Yeah.
Doctoring is an art as well as a science, and I am going to be there for my patients through thick and thin. So it's not about arguing with the other doctors. It's about starting a dialogue to get the most information because at that time information was coming from all around the world. And we're blessed that as an international practice, we were getting these from phone calls, emails, in addition to video conferencing from our friends that were in Australia, they were in Japan, all these different places. So we had first line information of what was working, and I wanted to share that with the other doctors, and that's what it's all about.
Everybody, you take all the information, everybody else's experiences, and help them with it. All right, now, we're going to bring along this thing pretty strangely here, but when I thought about telemedicine, Okay, and they told me, they send this notes out to everybody. They're really pushing it. Insurance companies are pushing it.
Mhm.
I'm thinking, okay, they're going to try to control the doctors. They're going to have some kind of call center in Timbuktu somewhere with all these residents or whatever, just young doctors that are sitting there, one person after the other person after the other person, and there's just it's like calling to have your computer software worked on, information in the Middle East,
Mhm.
and I'm like, I hope medicine doesn't be that. And then I realized, folks like you, that isn't going to happen. You're not going to put up with that.
Well, that's where I always share with people is like, find a doctor that's going to be around with you, and find
Right.
a doctor that's going to fight for your best interests. Because sometimes we don't have the knowledge, the information, or the ability to communicate. And that's when, as a doctor, I actually become your advocate. So if you have a
Right.
family member that's in the hospital, whether they're my patient or not, if you allow me, I will call on that behalf to get the information. Sometimes it's organizing hospice, sometimes it's organizing a specialist, or making the decision of, do we do chemotherapy or do we not? These are serious issues. And if we don't have all the information, when only one person can be in the room, which is the patient, they're not even allowing a family
Right.
member,
Right.
then you need that advocate to be on the phone with you or the video conference to help guide and ask the questions that you may not even be aware of asking. And that's where I think telemedicine is such a win. It's because we're able to really go out. And even with my own parents, when they would go to the doctor, the doctor would call me on my parents' phone. I would have that already in my schedule here at the office so that I could be there to ask the questions. Because with a mom who has Alzheimer's, that was very hard for her to communicate.
Right.
And my dad was, he was very old fashioned. The doctor's always right. And, bless their hearts, they're doing the best that they can. But every generation we're taught very differently, from your Gen Xers to your baby boomers. Baby boomers, gosh, they're intelligent. They are the ones that are going to question.
Right.
And you have to have that information and that background to be able to answer. And you have the Generation X's where they've already looked at all the Google reviews to see if that's where they should go. And, all that stuff can be manipulated. And that's why we build our practice from an organic level of one patient, one smile at a time, in order to serve the person who is in front of us. And that's our mission, is that we want people to be healthy, and we start with our community, our neighborhood, and we've been very fortunate to build a global practice.
It does. And of course, if you had your way, you'd be doing house calls.
I do still do house calls.
and so, but I think on the phone is one thing. Now, if you've got a video feed or something like that, okay, I can go with that.
Mm-hmm.
I mean, if I have a problem, I've got this funny thing, I can take my shirt off and put it up to the camera and do this kind of stuff.
And house calls have become more of the telemedicine.
Right.
That if there's, I can think of the last one that I went on, is the grandmother called me for the granddaughter that she just wasn't acting right. And I was like, what do you mean? But you could hear the franticness in her voice.
Right.
And I said, Miss Jessie, I will be there. She goes, what do you mean you'll be there? I said, I will be there in 15 minutes. This was a patient who fortunately lived very close by. And so, me and one of my teammates went over and we assessed it, and we got her the help that she needed, because she was in a place where her blood sugars had dropped and she needed some assistance, and her grandmother didn't know what to do.
Right.
And she's only 23 years old. She was young, and her grandmother's very, very young too. So it's just helping them and the moments that they need. And it was a blessing. And I think that's just a calling, is that in the voice when you need to move, and you need to do it now.
Yeah, but you also know the people. That's the difference. But, it's so hard. It's easy for people. I mean, you've helped with a family member of mine
Mm-hmm.
who has passed away, and you helped set up all this stuff.
Mm-hmm.
But, his wife was like, what do I do? I'm getting railroaded by the insurance companies. They're wanting to do this. They're wanting to do that. And you went, hang on. Let me handle it.
Mm-hmm.
I will do this. This is what I do. This
Mm-hmm.
is what I like to do. And you just stick, and you were, an angel for them.
The key is that, I always share with people, life is a terminal illness. At one point we are all going to not be here. So we need to take and have gratitude for the time that we are here, and be kind to others and serve others. And during those moments of need, if you have the ability to make it easier for that other person,
Mm-hmm.
that's what you're going to do. And fortunately, in medicine and dentistry, we get to affect the family, and that entire family. So that to us is a privilege and an honor to be a part of.
Yeah.
And one of our episodes that we recently did, and we talked about hospice care. And you can imagine with telemedicine and talking about hospice care, how that has changed in the ability. And that's why we did a podcast with 3 of us here at the Meridian team, because each of us it's so fresh for us. And
Right.
it was beautiful for our loved ones who have gone on and have passed away. It was a beautiful moment that we got to share, and we created a positive memory instead of something that was overwhelming, anxiety ridden. It was an ability to enjoy those moments that they went to the Lord and they're at peace.
You're right. And like you said before, telemedicine isn't really the end all of everything, but it is maybe a tool for your toolbox.
It's a tool for your toolbox. And if you happen to call a teledoc, let's just call it that for the moment, and
That's
you're
actually
not
the name of one of them.
okay, and again, no, I'm not pointing
Yeah.
anyone out here, is that if you're getting a prescription and the prescription just doesn't feel right, seem right, it's okay to ask again. It's okay to question. And I encourage that when you are preparing for your telemedicine appointment, have your list already written down. And if you can email the doctor, even better, so that you can have it up front to them. Any lab results, also send that, so that you can have quality time in your video and telephone conference with them.
That's also when it's good to have a pharmacist that you actually know. And who may catch something. I had an allergic to penicillin one time, and my pharmacist went, "You can't take this."
And unfortunately, that's probably the number one prescription that they are told to do in telemedicine, that are in these large conglomerates, is that the first prescription is amoxicillin. And I'm like, you've got to be kidding.
Right.
There's other things that we can utilize now, and there's very few people that can actually take amoxicillin. That's the number one allergy, is penicillin when it comes to medications,
Same,
that and sulfa. So, be sure you know your allergies and be sure that you share that. And that's why you need to be prepared with telemedicine.
People make mistakes. The glass perfect person was hung on the cross. So even your staff I know these guys, it's
we are here.
pretty minuscule, but people make mistakes. And so a pharmacist will always catch it at the end.
Well, but we don't want the pharmacists to be the
don't.
ones to catch it. We want it to be that we know you and we
Yes.
have a relationship, so that when your name comes up on the phone, video conference, on the schedule, we know exactly what your needs are. And if we need a reminder, we have a well-documented chart to help remind us. So that's one of the things that I think makes us very different in telemedicine, is that building a relationship with you, our patient.
You have pages on all your people.
I do. I do.
A dossier on all
I
of
do
your
have a
things.
dossier on all of them.
Oh, this was fun today.
Thank you.
We have to talk about some more stuff. Next week, I'm going to try to get you to tackle some stem cell stuff and things like that.
Absolutely. Would love to talk about stem cells.
That's pretty cool. Folks, we're out of time. If you have any topic you want us to tackle, anything really cool, send us an email, info@everydayhealthhacker.com. And I'm telling you, this lady will take care of it.
And remember, please comment, like us. Please subscribe on your
right.
favorite social media platform. And we really need some more likes, comments, and subscribers to YouTube and all of our podcasts. So have a blessed day. We look forward to seeing you next time.
All right, folks, on behalf of Dr. Lisa Liao, the great staff here at Meridian Health Institute, our producer, Jack McCraw, and myself, I want to thank everybody for joining to us today. Please sign up and look for us on social media. We're around everywhere, and just have a great day. What do you think?
Signing off as Everyday Health Hacker, Dr. Lisa Liao, powered by Meridian Health Institute. See you soon.
I like that.